From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Hello, St. Martin, and welcome to Prime Minister Talks. We are now in our Season 2, Episode 3. Not having as many as we would like, but hey, when we bring our episodes, it is very informative. And today, I must say, I'm very happy to have with me Mr. Bart from the Meijden. He's a communications coordinator at the White and Yellow Cross Care Foundation. He has a history of having worked on St. Martin since 2018. He has a master's and a bachelor's degree. His master's has propelled him to move here and to work with Mental Health Foundation. And now he is working at the White and Yellow Cross Care Foundation. I'd like for him to tell us a little bit about what he does there. But today he's here in his capacity as part of the team, the vaccination rollout team of St. Martin. And I think that he's a fresh new face for us in this respect, and he can bring some information that can help you to take that decision to take the vaccine. Bart, welcome.
Thank you so much for having me.
So tell us a little bit about what you do at the White and Yellow Cross Care Foundation.
Yeah, thank you. So I actually started in December, and with my background of social psychology, the first big assignment that was assigned to me is to see whether or not the vaccine was accepted or not amongst our staff, because we were the first priority group. So that was my first assignment. So I started doing a survey and then starting to provide information, basically rolling out a promotional campaign to do that. And that went well, and we already started in December. And actually via that project, I rolled into being the Workstream officer for communication and public engagement for the Vaccination Management Team on St. Martin. So one led to the other.
Great. So you are part of this vaccination management team.
Yeah.
What are the different stakeholders in that group? Like, who are the other persons in that? And basically, what have you done from then till now?
It's a good team. We have a vaccination manager, which is Henk Verdig. We have 5 work streams. The first one is about storage and the cold chain of the vaccines, of course. That's Frank Sang-Ching Pang, I think is his name. Then we have the person responsible for workstream 2, which is the locations, the logistics around the vaccination administration location, which is Marga Nolleman. Then we have workstream 3, which is the registration and monitoring, which is done by Mark Boosman. Workstream 4, that's me. And lastly, we have workstream 5, which is security and safety. And that's Chief Carl John. That's the center of the group. But we also have within our team Brechtje Boetekees, the manager of operations of the White and Yellow Cross, and Dr. Felix Holiday from the SMMC. Also Fenne Arnel, head of VSA, and Katja Meijden, who is assisting her. And of course, Eva Lista de Weaver from CPS, and also from CPS, Sanne van Kampen. And I hope I'm not forgetting anybody, because the list is quite long.
You're doing very well.
But that is, and sometimes people jump in and out, of course, depending on their role. But that's the
Great.
team. Yeah.
Great. It shows that there's a comprehensive team, that there's collaboration across various sectors. And you mentioned Mark Boosman, that's ICT for those who don't know.
Yeah,
so there's that strong component to make sure the registrations are going through a CRM that is protected and your information remains safe.
Definitely.
Great. In terms of registrations, how do you feel that that's going vis-a-vis also the rollout of the program?
Of course. We saw a big when we opened, it was like a big steep registration peak. We saw another peak after we administered the first dose last week. And after that, it kind of fell a little bit, and now it's steadily increasing again. It's difficult to say, it's difficult to predict something like this because there's many factors involved, social media, events that are happening. So it's difficult to say if it's under or above prediction. But what we can say is that especially the 60 plus, which we are vaccinating now, we still see relatively low numbers. So We do hope that that number is increasing. I checked this morning, I think the total number of registrations is 6,300, of which almost 2,000 are 60 plus. So yeah, we definitely need to boost that up even higher, but we're well on our way. Yeah.
Okay, so that already touched on one of the other questions I had. Some of the essential workers are also in this group, medical workers. Has that process been completed, or are they still in the group being vaccinated now? So like persons at medical center, from doctors' offices, etc. White and Yellow Cross, how's that going?
They were actually the first priority group. So healthcare workers with direct client contact. So we had the GP offices, the pharmacists, all in priority group 1. Most of them have been vaccinated. The turn-up was actually very high on that.
Okay.
And we're now in cluster 2, which is the 60 plus. And the next phase would be the 18 to 59 age group with underlying health conditions. And after that, the essential workers will become.
Yes. Yeah. Okay, great. In terms of that group of 18 to 59, I know a lot of people, you're saying first the ones with underlying conditions, but does that influence when people should register?
No, definitely not. We need to boost that registration number because we're receiving the vaccines from Holland. And if we can show that a lot of people want the vaccines, they will send more and we can do it faster because we're dealing with a strict deadline as well. The aim is to vaccinate or at least offer the vaccine to everyone on the island before the start of hurricane season, which is in a couple of months. So yeah, we need to boost that number of registrations up because that will also make it easier for us to plan the appointments and avoid spillage, because that's something that we definitely can't have.
Definitely not. And I think I explained that when I took the vaccine in terms of White and Yellow Cross's strategy to avoid any spillage, having a backup of persons that they would call in case they could not meet their quota for the day to avoid any wastage and spillage. And I must say I'm a proud recipient of my first dose of the vaccine. We're running up on our first break for today. So what I would like to do is, I think it's a good moment for us to take a break. You're doing great so far. And welcome our viewers to come back in a few minutes after these ads. This is Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Vaccines saves approximately 2 to 3 million lives every year and are therefore one of the most effective medical intervention ever invented. A vaccine protects you, but additionally it also protects your family, friends, and vulnerable people in your community. The more people get vaccinated, the harder it will be for the virus to spread. When enough people are vaccinated to create herd immunity, it can put an end to the pandemic. The government can then scale down the coronavirus restrictions and the tourists can return, which is vital for our economy. The COVID-19 vaccine will be free of charge for everyone. It is not mandatory to take the vaccine, but it is highly encouraged. If you have questions about your own specific situation, discuss them with your doctor. In the meantime, we must be responsible and keep practicing the COVID-19 safety measures like wearing your mask, washing hands, and maintaining social distance. This public service announcement has been brought to you by the Department of Collective Preventive Services and the Department of Communication.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Welcome back to Prime Minister Talks. As you all know, I'm Prime Minister Sylvia Jacobs, and in my efforts to continue to communicate openly with the people of St. Martin, this program was conceived. And today, Bart from the Meijden, one of the employees at the White and Yellow Cross, who is a key member of the Vaccination Management Team, is with me today to bring some information. I think he's already doing a great job of informing the people of St. Martin as to what has happened up to now. So we talked a little bit about the importance of registration, right? So go out and get registered. And in terms of maybe giving a clear idea, what happens once you have registered and it's your turn to get the vaccination? What is the process?
First, registration. Then you receive an appointment. confirm your appointment, very important. Otherwise, we don't know if you read the email or not.
Yes.
And we can't have empty slots or no-shows. Very important, confirm your appointment. Then go to your appointment, bring your ID. Doesn't have to be a smart ID. Any form of ID is allowed. We just need to verify that you're the person from the appointment. So if you arrive at the location, you first get a health check. Your temperature is checked, checked for symptoms of COVID. And if that's all okay, you show your appointment card to verify that it's you. Then you get a consent form. You'll be led to another room, at least by the White and Yellow Cross. You read the consent form. It has some questions on it about eligibility. Are you above 18? Are you pregnant? Do you have history?
Reactions.
In the past, but only severe ones. So not just a bit of sneezing, just severe allergic reactions. And if that's all fine, you sign the document and you go to another room, which is the administration room. They check once more the consent form, just to make sure, double check. Then you'll receive the vaccine. Then you'll be led to another room again. It's like boop, boop, boop. Which you'll be, it's a monitor room. You'll be monitored there for 15 minutes in the presence of a physician. That's because the severe side effects are very, very rare, but they do happen if people have a severe allergic reaction. And that almost always happens 15 minutes after. So just to make sure, we just sit you down there. And then after those 15 minutes, you're monitored, and you get an appointment card for your second appointment, because one dose is not provide maximum protection. 3 weeks later, you'll be asked to come back. You get a little sticker on your proof, your vaccination passport, and that's about it.
That is basically how I've also explained it. You've been a little more technical in terms of the rooms. I'm hoping that the people of St. Martin are clear. It is so important that you register, that you confirm via email that you've received it. There's also hard copies at doctors' offices, pharmacies, and also at the White and Yellow Cross.
We have
that you can have the hard copy to fill in the registration form. So those of you who have family members that are not internet savvy, do make sure that you register. That will ensure that we continue to get the vaccines to be able to get the herd immunity that we need on the island. Okay, so in terms of, you said it's rare that people have negative reactions because of severe allergies. But how have the persons, you are now at the White and Yellow Cross, seeing the persons going through the process, have we had any cases where persons have reacted badly?
No, actually, at the White and Yellow Cross, definitely not. We see almost everyone walk out with a big smile on their face. We've received many, many compliments on the whole process. Everybody was very, very nice about the way we set it up. And I hear similar stories about the SMMC and the CPS. So that's very good. In terms of side effects, actually, I don't think we had any severe cases. And also, from my own personal experience, I had it last week as well. I didn't feel any side effects. Also, the people around me that took it also didn't experience any side effects. So that's...
I didn't either. I barely felt. If I wasn't looking, I wouldn't have known.
Exactly.
So those of you afraid of needles, because I heard persons say, I'm afraid to take it because I don't like needles. I didn't even feel that.
Same thing.
It was a very small needle. I didn't feel anything.
Actually,
you mentioned locations. Sorry, you were going to say something?
Yeah, no, it's just in comparison, because 2 weeks before that, I had to get a tetanus shot because I got a cut in my hand. And that one was actually quite painful. And this one I didn't even feel.
Didn't feel it, yes. I also experienced one for my knees, and I'm like, it's nothing. It's absolutely nothing compared to that one.
Exactly.
With locations, you mentioned the White and Yellow Cross, Medical Center, and CPS. So now the third location is up and running as well? Yeah,
CPS is up and running, correct. The White and Yellow Cross and the SMMC mainly do their own, so their staff, and then they extend it for a week to take in a big portion of the 60 plus as well. But at the White and Yellow Cross and SMMC, that's now stopped for now. But all the people that received their first dose there are expected to come back there again in 3 weeks.
Okay.
But the CPS is now up and running. And I can also, that is just from the VMT meeting that we had, that will open up the Bel Air Community Center next week.
Oh,
So
wow.
that has
ramp up
proven
the
to
quantity.
be, yeah, exactly. And at first, there were some other locations mentioned in the rollout plan, but we continuously keep to evaluate the options, and Bel Air arose as an option, and it's actually very suitable. It's very large. We can have multiple priklijnen stations, so it turned out to be very suitable. So the plan is to start there next week.
Okay, that's great. And with the White and Yellow Cross, you have your in-house clients who are elderly, but are you also servicing the ones that the nurses go to visit at home?
Yeah.
Those are also covered in your rollout for the White and Yellow Cross. And
exactly.
The first batch is already done.
Yeah.
Wow.
Yeah.
Well, that's great.
Yeah.
That's great. I'm looking forward to hearing, that the second batch is done, and then now the seniors can have a little more freedom, accept their family members more, because I think that has been one of the biggest reasons I chose to do it, whereby the elderly, especially those who are, let's call it, in confinement, at the end of the day, they're separated from family. We're working, we're doing our everyday thing, and you can't even go and play it, play dominoes or just have a chat or hug them, etc. So I think for that reason, for the love of your loved ones, for the love of yourself and your community, because the more of us that are vaccinated, the faster we can get back to normal. We're rolling up again, Bart. You see how fast it goes on our second break. And so I'm going to ask you to tune back in, where we'll be having the final segment of this session, episode 3 for this season with Bart van der Meijden. Come back soon.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
The vaccination campaign for the COVID-19 virus on St. Martin has started. You can now register yourself and receive the vaccine. Simple and convenient via the online link. Step 1. Go to the official website of the Government of St. Martin at www.stmartingov.org/coronavirus and select vaccine. Step 2. Fill in your basic personal information and your contact details. Step 3. Fill in your identification number. This does not have to be a St. Martin ID. Step 4. Select the name of your house doctor. If you don't have a house doctor on St. Martin, please click None or prefer not to say. Step 5. Fill in the neighborhood where you live. This enables us to identify the nearest vaccination location. Step 6. Select the insurance company that you are insured with. If you are not insured or your insurance company is not listed, please select None or Other. Step 7. Select your preferred day and time of your appointment. We will do our best to schedule your appointment within the time frame as possible. Step 8. Upload your ID or passport. This does not have to be a St. Martin ID. Any legal form of identification will do. No immigration checks will be done. Step 9. Read the consent form about the security and protection of your personal information. Some important things to know. Your data is strictly confidential and is used only for the purpose of evaluation and scientific research. It will not be shared with third parties. Finally, click Submit, and it's done. You are now registered to receive the vaccine. When it's your turn, you'll be notified via WhatsApp and email. If you are unable to register online, the COVID vaccine registration forms are available at Collective Prevention Services, the Division of Labor Affairs, Public Service Center, Simpson Bay, and at the Government Building in Phillipsburg. Kindly submit your completed COVID vaccine registration form to Collective Prevention Services located at Vineyard Park Office Complex. For questions about vaccinations, the public can email vaccination@stmartingov.org or call 721-542-1570. This public service announcement has been brought to you by the Department of Collective Prevention Services and the Department of Communication.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Welcome back to Prime Minister Talks. We're having a discussion with one of the key members of the Vaccination Management Team, the VMT. You may have heard him say that just now, Mr. Bart van der Meijden. And it's been a very interesting conversation talking about the role he plays, what has been done so far with the rollout of our St. Martin's vaccination program. We talked about the different locations. A big location is coming up soon. This week, I think it was in the media as of March 1st that the public rollout would happen. And I think that needs to be clarified because people think, okay, all of us can get it now. So can you roll out when you say the public rollout, when the team says that, what that means? Because you mentioned before the cluster of seniors still is ongoing at this moment. So the public seniors, not necessarily those in the St. Martin home or whatever.
Exactly.
So can you...
Yeah, so we have like a priority listing, right? So first and foremost is the healthcare workers, the direct client contact. Then it's the seniors, 60 and up. And then it's 18 to 59 with underlying health conditions. So we're slowly moving down. That also depends on the permission from the Netherlands, who provides the vaccines, of course. They also have to deal with their situation back home. There's a scarcity of the vaccine. So it's, and it also depends on the amount of registrations. If we have more registrations, we'll sooner get the green light, etc. So the next phase we're going to go into is people with underlying conditions. And what those conditions exactly are, we'll communicate via the channels. I think they're comparable to people who are eligible for the flu shot. So that's the next phase we're looking into. And if you among those, you'll receive an appointment if you're registered. So we faster.
No, because you will get an appointment.
Yeah, definitely.
Let's clarify
before all the people in later clusters. That doesn't mean if we now say we're going to move to cluster 3, that clusters 1 and 2 are excluded. It's just now
it continues.
Exactly. So now it's 1, 2,
and 3. So that's good to know because I keep getting the messages. When can I get mine? When can the seniors over 40? That was a specific question. When can the seniors over 40 get their vaccination? So I told them, just make sure you're registered and you will get that appointment. I think filling out the form online, highlight what your underlying conditions are because that makes a difference in you being chosen above in this time frame, right?
Exactly.
So 18 to 59. Right? With underlying conditions.
Exactly.
So the seniors are still ongoing or?
Still ongoing.
So the 18 to 59 has started?
We're going to start next week.
So this week is still seniors.
And a little note on that is that Holland just gave the permission for all the people with who are eligible for the flu vaccine. So the complete list of underlying conditions has some more on it, but just a part of it.
Yes, because I would think with that, you'd keep in mind when we had the first outbreak, the persons who were having either had cancer or they had diabetes, high blood pressure, or combinations of those were the ones that we saw that were having severe conditions.
Exactly.
So they're prioritized.
Yeah, definitely.
Good. Register. I think bringing awareness is everybody's job. And so as part of the rollout, what else is being done to promote the vaccine?
So far we mostly did our communication online via the channels in the newspapers, etc. And what we saw now is that the 60 plus category is still a little bit low, which in a sense makes sense because a lot of the older folks aren't that tech savvy. So what we're planning to do now is to print a lot more. We have an information flyer with all the relevant information about the vaccine, which we'll print. We've planned a active outreach. So we plan to go into the neighborhoods, reach out to those people in different languages as well. What else? Distribution. We're gonna put up different stands at the community help desks where people can go to ask information, ask questions, but also to register there because it can be a hassle. We know, and we try to make it. And we try to make it as easy as possible. And we also want to encourage everyone who knows someone who is struggling. So if you have a neighbor or an uncle,
to help them, just
offer to help.
Yes.
Hey, you know what? Do you want to? And maybe I can help you. Maybe I can help you register because I know how to work with a phone or a tablet.
Mhm.
Maybe I can even drive you to. Sometimes
The
logistics
location.
is
Yeah.
an issue. So yeah, we're hoping that not only us but also other people in the community and maybe also organizations take ownership of the big campaign and the quest that we're all dealing with.
Yes, definitely. I think we saw that with even the COVID-19 awareness campaigns.
Mhm.
You said you came in December, so you missed that.
Mhm.
But there was like
No, I was on the island.
Oh, you
though.
was here.
Yeah.
Oh, you were. Oh, yeah, you were mental health.
Yeah, good.
The thing that I think that outreach program within the communities and utilizing the help desk is a great idea. So.
Definitely.
Even though now the help desk aren't going to be used as vaccination points, it's still a point of contact for information and to register.
Little side note, it might be that we're still going to utilize that as vaccination locations. Yeah, it all depends on the demand. So if heaps of people sign up, register, and Holland just sends us enormous batch of vaccines, then we might decide to use them after all. But for now, looking at the situation that we have now, we decided to only use CPS and next week Bel Air.
And would people still, if they wanted to be in a medical facility, be able to have it at the hospital? Do you think? Because that question also came to me.
Yeah. Not at this point, but we can assure you the vaccination locations are under the highest standards.
And always with a medical doctor.
Always, definitely. And the requirements for it to be a valid vaccination locations are long. And so everything, the whole preparation is extensive. And we can assure you that we can offer the same type of organization and procedure at the CPS, at the Bel Air, as in the SMMC.
Okay, that's great. And I know that part of it is that you have on standby because if anything goes wrong, it will go wrong within 15 minutes and that person will get the immediate attention and everything is on location to deal with a severe allergic reaction.
If it arrives.
If it happens to occur. Wow, we've come so fast to the end of this thing. I really want you to take the time you have some time to look into that camera and encourage people out there to come out, get registered, and get vaccinated.
Okay, perfect.
You have the floor.
Thank you. We know that there's still people out there who are doubtful. To be honest, I was doubtful in the beginning too. But I would really advise everyone to do their research. It's not as easy. We know that. There's a lot of information out there. There's also information bubbles. So, like sometimes you're in an information bubble of negative publicity and it seems like that's the whole world, but it actually is a fraction from it. So I advise to use credible sources when you do your research. Use for the World Health Organization, CDC, government information pages. Those provide credible and science-based information. Use that information to make up your own mind, but do understand that there's a big importance in this vaccine for the island, for the vulnerable in our community. We have a tourist-based economy and tourists will come back to the island once the pandemic is over. So that's an economic issue there as well. And we want to go back to normal.
Exactly.
And the cases are low now here on the island,
Thank
luckily.
God. Yes.
But I don't want to spoil the fun, but in Aruba, for example, this situation was like a month ago as well, very low numbers. And the different strains that are going around, make for a steep peak there in hospitalization. So it's just really necessary that we all take up this challenge and register and help each other.
Thank you so much, Bart. We've literally run out of time. I want to say thank you to you and continued success with the good work you're doing. It requires a whole lot of us. We can do a lot by ourselves, but when we are together, we get so much more done. Exactly. People of St. Martin, this has been Prime Minister Talks. I have had a wonderful time bringing this information to you. As Bart said, get the information, get registered, and even while we're doing that, stay protected. Don't drop our COVID protocols because we're not out of the woods yet. And there is the more variants on the island that we need to be cautious of. It spreads faster. It's not making you sicker, but at least that would mean the numbers would go up quicker. So protect yourselves and your family. Go out, get the information, get registered, get vaccinated, and we will get back to normal, hopefully by June. Until next time, I'm Sylveria Jacobs. This has been Prime Minister Talks.